for patients and providers to connect early on in a difficult situation such as the pandemic. It's a great way for patients to check in with their provider if they are having an issue. It's easy access to your provider. A lot of times you get a same day appointment. And for the provider as well, it's a way for us to just kind of lay our eyes on you.
If I have to look in a patient's ear, obviously telemedicine isn't very good, but I've been able to look at patients' throats in telemedicine, and for follow-up on anxiety, ADHD, depression, it can be just as effective as an in-person visit.
As far as convenience for patients, I think the reticence to access care, regardless of economic stature, some people just don't like to go to the doctor, and I think it's inconvenient for them, and I think telehealth kind of bridges that gap.
Telemedicine has a great role in certain areas, and especially routine care and medication management, blood pressure, diabetes. All these things can be managed.
We'll continue to have telemedicine even after COVID. So I think it's been great, definitely a huge change. We went from seeing 20 plus people in person to sometimes having a whole day of just telemedicine.
I think it's absolutely necessary, and it really helps the provider as much as it helps the patient. We can answer questions, we can ask more pointed questions about why testing is needed so that we can adjust the way that care is delivered to meet the needs overall of a patient.
While for some patients things might be straightforward, for others it is not, and a patient might not see a certain problem or might not see a value of a test they might need in addition to the COVID test, or they might think they would need one kind of COVID test while another test would be better suited for them. That's why it is really important to do that visit, even if it was a brief visit, even if it was, it seemed straightforward for that particular patient. For another patient, or even for the same patient on another day, they might learn something from the doctor that they hadn't thought about.
Telemedicine, it was very useful for when early in the pandemic. It helped to reduce some of our resources, our gowns and masks, and we're burdened by those, and also to be able to see more critical patients. So it helped with that sense. It provided significant more access to those who couldn't and who wouldn't. If they didn't have COVID, it's like, hey, you were going to expose yourself coming in. So there's a lot of things we could help with tele. So
I love televisits. I wasn't doing them before. I was a little reluctant, but there's so many times where it's so convenient for the patient, and it actually works well as a physician.
Telemedicine is really very, very useful. I think it will be the trend for the future. Even after the COVID is over, I think telemedicine will continue.